Good evening, everyone. Warm welcome to Dogs Victoria members here this evening, as well as all the people that we're more widely connected with through live streaming. Following Robin's talk, there will be some time for questions, but I'll need to take the mic to use, particularly so the live streaming can pick it up and hear what your question is. My name's Margaret Gray, and as a member of the Education Subcommittee, I'd like to thank Wendy Johnson, who can't be here tonight, for facilitating this evening through the long-standing relationship with Animal Eye Care and the Golden Retriever Club. This evening's seminar continues the Education Committee's education theme for health theme for 2019, and we're pleased to introduce veterinary ophthalmologist Dr. Robin Stanley to talk to us about both eye issues and the tools that are available for breeders to use in making good decisions for our breeding practice. Robin's an honours graduate from the University of Melbourne. In 1988, he was admitted as a member of the Australian and New Zealand College of Veterinary Scientists in Small Animal Surgery, and then in 1990 as a fellow in ophthalmology. He was a clinical consultant and visiting lecturer senior lecturer at the School of Veterinary Science, the University of Melbourne, for 22 years, and is still a tutor at the Centre for Veterinary Education at Sydney University. Robin has lectured throughout Australia and also in New Zealand, Japan, Singapore, Taiwan, Thailand, Malaysia, Hong Kong, Sweden, England, South Africa and the United States. And what's more, Robin conducted his first eye clinic with Carol Stafford from the Golden Retriever Club back in 1988. He's presented at breed nights and clinics throughout Victoria and also in South Australia. So it's wonderful to have you here this evening. Please welcome Robin.
Thank you very much for coming along tonight, and I'll move this over here so I don't keep moving around for the live streaming. Thanks very much for coming along. I actually got here early tonight. Often, as what happens when you visit vets, people are running late, vets are running behind. So I'm usually running quite late, so I'm always in a rush to get to my talks. And previously I was running late, and suddenly there was a flashing blue light, and I thought, I can't stop because I'm going to be late to my talk for the breeders, and I can't possibly stop. So in the bottom of my bag I found my ophthalmoscope, and I waved it at the policeman, hoping he'd recognise I was a veterinary eye specialist and I had to be somewhere important. There was no response, and I found a stethoscope, and I waved my stethoscope at the policeman, hoping he'd sort of wave me through. When he waved his handcuffs back at me, I thought I'd better stop. So I just thought I'd start by introducing the team. Obviously Margaret did a great job in introducing myself. We're very fortunate to have Heather. Heather's a veterinary eye specialist, and she's also board certified, which means she's at specialist level in internal medicine, but she only does ophthalmology, and she's come out from the US and she's joined our practice last year. Heather's also on the American College Exam Committee, so we're learning lots from her. Jane's a professional interest practitioner in ophthalmology, and Matt on the end is a resident in veterinary ophthalmology, so he's actually just about to finish his training program. Next year he'll credential, and the year after that he'll hopefully become another eye specialist, because there is a bit of a shortage of eye specialists around. So, why are we here tonight? We're talking about inherited eye diseases. Now, when I lecture to veterinarians, and for 22 years, as Margaret said, I lectured to veterinary students, one of the things I always tell the students is breed predisposition. Unfortunately, eye diseases occur by breed. So if you know the breed, you can actually look up the eye diseases. So here we are, we've got a Bedlington Terrier in its full show clip. So a few years ago, more than a few years ago, at the veterinary school, one of the things I'd often do is I'd ask the students, what breed is this? So we had a Bedlington Terrier come in for an eye check before breeding, and I said to the student, what sort of breed is this? And the student said, it's a Border Leicester Merino cross. So I gave them 0 marks for knowledge, but full marks for having a sense of humour. So I thought that was quite good. So breed predisposition is very important. So we talk a lot about breed predisposition. And unfortunately, as breeders, when we line breed, we tend to flare up with orthopedic problems and also with eye problems as well. There's a couple of areas where you can get this breed information. One is on our website, and the other one here is the American College. This is the American College of Veterinary Ophthalmology, and they do a thing called the Eye Certification Scheme in the US, and there's a thing called the Blue Book. The Blue Book I find really, really interesting and really helpful in my practice. So you can actually readily download that, and you can actually look up each specific breed. And they'll actually have recommendations from the American College of Veterinary Ophthalmologists as to whether to breed from certain diseases. The other thing I find really useful is they've actually collated their information back to 1990. So they'll say we saw 4,327 golden retrievers and we found X number of cataracts, X number of dogs with PRA. So if you ever have a problem, if a breeder comes in and this is a problem we don't see, I immediately jump on, look at the Blue Book, have a look and see what's actually there to see whether it's been recorded before in the breed. And I find that to be really, really useful. So that's a really useful thing, particularly because it's got the incidence of eye diseases that are there. So I find that to be very, very, very useful. So one of the things I hope you're all aware of is the Australian Canine Eye Scheme. And the Australian Canine Eye Scheme was set up a few years ago, and basically it's a national assessment system for registered dog breeds and offers reliable screening services for a range of congenital and inherited eye problems. The eye examinations are only done by registered specialists, and the program is administered by the Australian Veterinary Association and is endorsed by the ANKC as a reliable screening service, particularly to dog breeders and owners. And I see Bob Maver's name on the board there, and Bob was very instrumental in actually setting up the Australian Canine Eye Scheme. We've had a few teething problems over the years, and we're now moving towards an online eye certification scheme, and I think that will be very beneficial. One of the other things is if you actually look at the website here, you can actually download the Chief Panelist report. So you can actually see in Australia we had 476 golden retrievers examined, and we found problems in X number of dogs and things like that. So it gives back a bit of useful information that's there. Margaret mentioned before the Golden Retriever Club, and we started doing eye certification back in 1988. We did a clinic out at Boronia Vet Clinic on a Sunday afternoon, and that's sort of grown, and we've done 2 a year for the last, 31 years. What's really interesting, Golden Retrievers here in Australia have a much lower incidence of eye disease compared to overseas, particularly in England. So that can be very, very useful. With the Australian Canine Eye Scheme, hopefully what we're going to be doing is to having an online scheme, and then the results and data can be collected online. Because one of the things I'm sure you're all aware about is there's a lot of rumour and innuendo, and I think it's really good if we could have information published and show there is a problem here, or these lines are clear, or these lines have a problem or an issue. because I think that's a really good way of reducing the incidence of inherited eye diseases. So for an ACEs examination, basically the registered eye specialist will be doing the actual eye examination. We check the pupillary light responses with a focal light. So we often do that in a dark room. If we're going to do gonioscopy, gonioscopy is an examination of the drainage angle, and I'll talk a little bit more about that in a minute. We do that before we put the dilating drops in. We fill in the ACEs form, so it's very important if you're coming along for an ACEs or a breed certification. It's very important to actually bring your pedigree along so you can write out all the pedigree details. And then we also check the microchip. So basically everything relies on the microchip, and it's frustrating sometimes when we can't find a microchip or something like that with dud microchips we've had from time to time. So here is my Australian Shepherd. So he's having his eye examination. So we do this in a dark room. So the first thing we're doing is the focal light exam. We want to make sure that the pupils close down. That's a really important thing to do. Then we're having a look with magnification. So this is a portable microscope. I'm sure you've all been to the optometrist or the eye specialist and you put your head inside the frame. Well, dogs don't do that very well, so we actually have a portable slit lamp. And then once the pupils have dilated, we actually have a look with the indirect ophthalmoscope. So we're basically checking the eye from front to back to make sure that it's otherwise healthy. Now, the other thing that we do for some breeds of dogs is gonioscopy. Gonioscopy is examination of the iridocorneal drainage angle. So there are certain breeds that are predisposed to glaucoma. Bassets, Australian cattle dogs, golden retrievers, cocker spaniels. There's a number of breeds that are prone to this. Now, with gonioscopy, if the drainage angle is abnormal, then they are at risk of developing glaucoma. So all purebred dogs with primary glaucoma, that means there's no other disease there. Primary glaucoma. Glaucoma is where the pressure builds up inside the eye. In humans, the pressure builds up slowly over years. In dogs, we have acute glaucoma. So one day, the normal pressure is 10 to 25. So one day, the dog can have a pressure of 15. The next day, the pressure can be 70. And in those cases, all dogs with primary glaucoma have an abnormal drainage angle, which is called goniodysgenesis. And that's really important because some lines are more prone to glaucoma than other lines. And again, glaucoma occurs by breed. The problem with this gonioscopy examination is that not all dogs with an abnormal drainage angle, goniodysgenesis, will get glaucoma. So it's a certain risk factor, and in certain lines it can be very useful. And generally speaking, the gonioscopy is just a one-off test. With flat-coated retrievers and curly-coated retrievers, you may need to do the drainage angle exam in a year or two later because that can change. But most breeds, it's just a set examination, a once-off. So to me, if you have a line that's had any issues with glaucoma, definitely worthwhile getting gonioscopy done. Interestingly, Heather, who's come from the US, over in America, they're actually quite happy to breed dogs with abnormal drainage angles. Here in Australia, we tend not to, because in Australia, we've been influenced by Tony Reid, the eye specialist in Adelaide, and he did his thesis on this, and he showed there's quite a marked inherited tendency. But one of the things that can happen is even if you had a dog that was affected, you breed it with a normal bitch, you actually dilute out the problem. So you're always trying to breed away from it. It's a bit of a controversial topic. Happy to take any questions at any time. So with gonioscopy, here is my Australian Shepherd Blue, and we've put this little contact lens in the eye. You can see the pupil here, and you can see the colour of the eye. My dog's a blue male, so he's got one blue eye and one brown eye, and you can actually see the drain of the eye there. And that's what we're looking at, is the drain of the eye. If the drain of the eye is abnormal, then they're at a greater risk of getting glaucoma. The problem is, not all dogs with a bad drainage angle will get glaucoma. And here we are looking at the contact lens, or we're looking at the drainage angle through the contact lens with the microscope. Questions? No? No? Excellent. All right. So, gonioscopy, is it worth it? Yes. If you have a breed that's prone to glaucoma, and if your lines have had glaucoma, definitely get it done. So here is a dog with glaucoma. The eye is blue, the eye is red, the pupil is dilated and non-responsive. Unlike in humans, glaucoma in dogs occurs very quickly, literally overnight. And these dogs can go blind within 24 to 72 hours. 1 to 3 days, blind. And what's worse, causes pain. These dogs can sometimes be really depressed, quiet, obviously uncomfortable. So glaucoma is a horrible disease, and it is very, very, very difficult to treat. It's one of the diseases I particularly dislike. Now, the other thing I wanted to talk about was genetic testing, and thanks to George from Orivet, who sent me a list of the genetic tests that are available with respect to eye diseases. So this is a test of all the eye diseases, and then George also sent me a list of all the breeds that are predisposed to PRA for which there's a genetic test, and I couldn't fit it into this talk. It's this huge long list. Genetic testing, I think, is extremely valuable, but one of the common mistakes that people can make is to breed on the sole results of the genetic test. They go, oh yeah, we're clear of this, so I'm going to breed. It's easy for me as an eye specialist, because all I'm worried about is the eyes. You guys as breeders have got to look at the whole picture. So, genetic testing, what do? It's very, very useful, and I think genetic testing should be one of the things that we should do. Particularly with some of the genetic tests, we can actually identify dogs that are genetically normal. They don't carry the genes. We can identify dogs that are carriers, and we can also identify dogs that are going to go on and develop the disease. Because some of the diseases, such as PRA and cataracts, develop later in life. Classically, PRA comes in between 5 to 8 years of age. You may have already bred that dog a number of times, and it's too late, as it were, to catch that. So if you're doing DNA testing early, it's really useful, because you might identify a carrier or a dog that's actually going to be developing that disease. But as I was saying before, don't breed just upon the DNA results. You guys have to look at the entire dog. You've got to look at the phenotype as well as the genotype. So here's a dog that's got a perfect eye score. The eyes are perfectly healthy. Would you want to breed with this dog? Doesn't look like it wants to be bred from, does it? No. So see, as an eye specialist, I would be happy because the eyes were normal until the dog bit me, and then, yeah. Any questions? All right. Now, we're going to talk a little bit about entropion. Entropion is where the eyelid rolls in. What's interesting is entropion is not considered to be an inherited disease, so it's not actually part of the ACEs scheme. Okay? We don't consider it. So what's happening here, this poor Staffordshire Bull Terrier, it's got its eyes closed because the eyelids are rolling in, and that's entropion. In this dog here, we can see the hairs actually touching the cornea. The eyelid hairs are rolling in onto the cornea and causing irritation, and we can see that the dog's got quite large eyelid openings. Entropion is considered polygenetic, and what that means is there's probably a number of genes involved, and then entropion can sometimes be brought on if the dog is in a particularly allergenic environment. So, for example, if there's a lot of dust or dirt or irritants, you can then actually get the eyelids rolling in secondary to all the irritation. So that's why we probably don't have it on the ACER scheme. But if you came and spent time in our practice, you would see today Rottweilers very commonly presenting with entropion. We probably do a Rottweiler once a week with entropion. Staffordshire Bull Terriers. There's certain breeds that are more prone to developing entropion. So I think there's a significant genetic predisposition there. So with entropion, we do surgery. But in little puppies under 6 months of age, we will do what we call tacking stitches. So Shar-Peis, Chows, Golden Retrievers, Labradors, and other large breeds from time to time. When they're little puppies, the eyelids will roll in. What happens there is we put little tacking stitches in. So we've put some little tacking stitches in this little Shar-Pei puppy, and we've lifted the upper eyelid. In this Shar-Pei puppy, the upper eyelid was rolling down and onto the eye. So we've actually lifted this upper eyelid. And we do eyelid tacking in dogs under the age of 6 months. Because most of the time, probably 70% of the time, these pups then actually grow into their eyelids. But once they're over 6 months of age, we actually do surgery where we actually cut tissue out and remodel the eyelid so it's sitting more normally. We can also get ectropion, and lots of bloodhounds and basset hounds can have droopy eyelids. And we can see here in this dog that the lower eyelid is very droopy, and you can actually see the third eyelid here, and it's very mucky. I've put some fluorescent stain in, so it's not actually green discharge, it's the fluorescent stain that I put in. And we can also see the upper eyelid is drooping in. So a lot of dogs, bloodhounds and bassets with the droopy eyes, that's called ectropion, and that will actually predispose to conjunctivitis and dry eye and irritation that's there. Here is a St. Bernard, and we can't even see the eyes, because what happens is the eye is so irritated by the abnormally fitting eyelids that the third eyelid's gone up. And this is what we call a diamond eye, because it looks like a diamond. So the eyelids are just miles too long, it's droopy, and this part of the eyelid's rolling in, there's a kink here, and this part of the eyelid's rolling in. So it's very, very important that the eyelids sit normally so that the eye is protected. But unfortunately, many breeds of dogs are bred to have large eyelid openings or a droopy face. And we can see here this poor basset hound. Again, we can't see the eyes because this basset hound's got so much loose skin on its head. The loose skin is rolling down and irritating those eyes. Here's an older Cocker Spaniel. And older Cocker Spaniels with their big floppy ears, the whole face tends to fall down. And what's actually happening here is we can actually see the hairs irritating the cornea. And that's really important from a breeding point of view, that we have breed standards and we try and achieve dogs that have good fitting eyelids. because a lot of eye diseases that we see, conjunctivitis, dry eye, corneal ulcers, can be contributed to by having poorly designed eyelids. The next thing we're going to talk about, extra eyelashes. Extra eyelashes are hairs that grow right on the eyelid edge. And you know how irritating it is when we've got an eyelash loose in our own eye. Imagine here, we can see these large, thick, stiff eyelashes actually rubbing on the cornea, and we can see a little bit of cloudiness and scarring here. And there's also extra eyelashes here. And here is a Staffordshire Bull Terrier with large, thick, extra eyelashes. Many dogs have extra eyelashes. Most poodles, most Cocker Spaniels that I see have extra eyelashes. But these are small little hairs that aren't causing any irritation, so we don't worry about them. But in some breeds, particularly Staffordshire Bull Terriers, sometimes Golden Retrievers, they can be quite large hairs and they're irritating the eye, and in those cases we need to do surgery. And it can actually cause quite intense irritation. It can cause severe corneal disease, even ulcers, and scar tissue can develop on the cornea as well. So it's really, really important to breed away from extra eyelashes. Again, extra eyelashes are not considered to be hereditary on the ACEs scheme, but it's suggested that they are a dominant trait with incomplete penetrance. So if you have an affected dog or dam and you breed with it, most of the puppies will probably develop extra eyelashes, but not always straight away. Another thing that we see from time to time, particularly in Shelties and poodles, and increasingly just recently in pugs, we have these things called ectopic cilia. So this is a picture actually taken through the operating microscope. We're looking on the inside of the eyelid, so the edge of the eyelid is there. We're looking on the inside of the eyelid. And can you see this hair? It's actually growing on the inside of the eyelid. So this is called an ectopic cilia. Ectopic meaning out of position and cilia meaning hair. And these hairs are growing right on the eye and cause quite a lot of irritation. And these dogs can be quite sore and uncomfortable. Any questions on extra eyelashes or ectopic cilia? Yes? How do you remove them? Good question. How do we remove extra eyelashes? There's a number of techniques that can be used. In our practice, I really like what we call transconjunctival excision. So under a general anaesthetic and using an operating microscope, we actually make small little incisions on the inside of the eyelid and cut out the roots of the extra eyelashes. If you just pluck the hair, it's going to regrow. You can use diathermy. The problem with diathermy is that it can actually cause scarring, so I'm not a big fan of it. The other technique is cryotherapy, where we actually freeze. The extra eyelash root is actually quite sensitive to the cryo, but I personally find transconjunctival excision to be the most effective. But we've had some staffies lately, and they've had 30 or so extra eyelashes per eyelid. The poor dogs, they're really sore and uncomfortable. Conjunctivitis. Well, conjunctivitis isn't really an inherited problem, except if we have large eyelid openings or dogs with deep set eyes. They're going to be more likely to get conjunctivitis. But I guess as breeders, you're talking to a lot of dog owners, and conjunctivitis is actually probably the number one presenting eye condition or eye complaint that you can have. So, with conjunctivitis, commonly conjunctivitis is just an acute bacterial infection. So the dog's been swimming or it's met another dog with conjunctivitis, And usually bacterial conjunctivitis gets better with any treatment. It can be eye drops, eye ointment, cortisone or antibiotics. So most cases of conjunctivitis will respond really quickly. But a lot of cases of conjunctivitis, and this is where you might get contacted, oh, you know, my puppy's had recurrent bouts of conjunctivitis. If the conjunctivitis is recurring and or it's not responding to medications, you need to start to look for an underlying cause. And there can be a number of underlying causes. By far, the number one underlying cause for recurrent conjunctivitis is dry eye, a lack of tears. And this is very, very common in some breeds of dogs. At our practice, whenever we see a West Highland White Terrier or a Cavalier or a miniature Schnauzer with conjunctivitis, we just assume that they have dry eye otherwise. Foreign bodies, particularly springtime, summertime, if you have a dog that has a recurrent conjunctivitis with lots of discharge, think foreign bodies, grass seeds. Another one that can be a problem is actually allergic conjunctivitis. So some breeds of dogs seem to be more prone to allergic or reactive conjunctivitis. So often allergic conjunctivitis, these are quite chronic, they're ongoing, and it's usually a reaction to plant pollens and allergens. So often the eyes are red, you can see here the third eyelid's red, the conjunctiva is quite thickened, the eye itself is a bit red, the actual eyeball itself is normal. Sometimes these become chronic and we see these little lumps sitting in the eyelid, and this is actually called follicular conjunctivitis. There's little follicles or lumps that develop, and this is a sign of allergic reactive conjunctivitis. And in these cases, there may be chronic redness, discharge, either watery or watery and mucky. They may rub at the eye. And these chronic conjunctivitises will require long-term treatment. In humans, cortisone drops are frowned upon because cortisone drops in humans can predispose to cataracts and glaucoma, not in dogs. So many dogs are on long-term cortisone drops with very few side effects to try and control this allergic reactive conjunctivitis. As I was saying before, one of the big problems that we can have is dry eye. And dry eye is a lack of tears. West Highland White Terriers are the number one breed for dry eye. Be suspicious of dry eye if you have this very thick mucoid discharge. And one of the characteristics of dry eye, can you see how the discharge is drying and crusting on the edge of the eyelids? In this Westie, you can see a little bit of mucus here, and he's got his eye closed because the eye is sore. And in the Shih Tzu, we can see the discharge, the crusting, and can you see blood vessels and scar tissue that have grown into the cornea? And that's a sign that the eye is drying out. So these dogs will get conjunctivitis, and the tears, the lubrication, are really, really important in providing nutrition to the cornea. And without tears, scar tissue actually starts to grow across, and that can cause problems. So with dry eye, marked breed predisposition, West Highland White Terriers, Cavaliers, and also miniature Schnauzers. Interestingly, in parts of Europe, when you do an eye certificate on a Cavalier, you have to actually do a Schirmer tear test, and they document that on the form. One of the little sayings that I have is a Schirmer tear test. That's how we diagnose dry eye. So if you have a dog with recurrent conjunctivitis or with corneal disease or ocular discharge, I'm sure your local vet will do a Schirmer tear test. And think about that. If you have a puppy of yours that's got recurrent conjunctivitis or ocular discharge, think dry eye. It's a commonly overlooked treatment, it's a commonly overlooked underlying cause for these dry eyes, for conjunctivitis, corneal disease and mucky ocular discharge. And with dry eye, we actually use a drop or an ointment called Optimune, and in more severe cases we'll use a drop or an ointment called tacrolimus. And like anything, we get a better response when it's treated early rather than later. So dry eye is commonly overlooked, and as I said, if you see recurring ocular discharge, recurrent conjunctivitis or corneal disease or ulceration, think dry eye. Almost every day we'd have a case in our practice where the dry eye hasn't been diagnosed. While we're talking about disease, we'll talk a little bit about corneal ulcers. Again, not really an inherited problem, but some breeds of dogs can have these indolent or spontaneous corneal ulcers. So again, if you have a puppy or a dog that has an ulcer, always look for an underlying cause. What has actually caused this ulcer? Rather than jump in and say, well, I need to treat it with this, this and this. What's actually caused it? Again, dry eye, extra eyelashes, dogs with large eyelid openings, dogs with protruding eyes are going to be much more prone to corneal disease. In boxers, corgis, Samoyeds and golden retrievers, they are prone to what we call indolent ulcers. And indolent ulcers are ulcers that are very slow in healing. Normally, an ulcer should heal within 7 days. And by default, if an ulcer hasn't healed within 7 days, we call it indolent. And these dogs can be predisposed to this, and they can be sometimes difficult to treat. So in these cases, one of the classic signs of an indolent ulcer is the epithelium, the skin layer over the top of the cornea, just wipes off, and you can see these loose edges. And you may have heard about vets gridding ulcers, and this is where we grid ulcers because we're trying to get rid of this unhealthy tissue. And what we've done here is, under the operating microscope, we've actually made little incisions into the cornea to try and help the ulcers to heal. One of the other comments that I would make is that all eye specialists love doxycycline. Doxycycline's an antibiotic, and I would highly recommend that if you ever have a dog with corneal disease, particularly ulceration, make sure they're on doxycycline. I think that really seems to help stimulate the healing, reduce the risk of infection, and also helps in itself, the doxycycline helps to reduce or minimise the scarring that's there. Any questions?
Just with the ulcers, I've found that if someone is diagnosed with an indolent ulcer, you're best to go straight to an eye specialist rather than mess around with your vet, because I don't think vets know how to treat them properly.
Yeah. Ulcers can be tricky in occasions, and particularly in the purebred dogs with these indolent or slow healing ulcers, they can be quite tricky. And sometimes they take months to heal. Yep. Yes, Sel?
About the dry eye, is a mucus associated with dry eye, or does it just happen with dry eye?
What happens is the tears are lubricated, or the eye's lubricated with the tears. And when there's a lack of tears, the eye gets irritated and the body then produces more mucus there. So It's a symptom. The mucus develops as a symptom of the dry eye, but it's really important whenever you see extra discharge from an eye to do a tear test. Yep. Glaucoma. Certain breeds are predisposed to glaucoma. So I commonly see Bassets, Australian cattle dogs, golden retrievers, Maltese with glaucoma. And as we were saying before, this is sudden onset. So the normal pressure is 10 to 25 millimetres of mercury. So there's a certain amount of fluid in the eye, and that fluid is very carefully regulated for the health of the eye. And what can happen is that dogs can get acute glaucoma, so the pressure will shoot up literally overnight to above 40. And the cardinal signs of glaucoma are a red eye. You can see it's very red, very red. A blue eye, the cornea goes cloudy, so we can see that the cornea is cloudy. And you can see in this dog, the pupil is dilated, and in this dog, the pupil is dilated. Red eye, blue eye, dilated non-responsive pupil. And these dogs are often quite sore and uncomfortable. Really sore. Really sore. Glaucoma is a real emergency. Dogs will lose their vision within 24 to 72 hours. You've got to get onto it really quickly. In some cases we can use medical treatment, Xalatan. In some cases we'll consider surgery, laser surgery and drainage implants. Glaucoma is a horrible disease, and many dogs with glaucoma will go blind despite everything we do. I remember a couple of years ago organising a conference for the University of Sydney, and we had 250 vets come along, and one of the speakers was the world guru, and he said, I'm going to talk about glaucoma. And basically they all go blind, and in the end you have to take out the eye. And there was an element of truth in what he had to say. Glaucoma is a horrible disease. So many dogs with glaucoma will end up blind despite all we do. And that's why it's really important to be aware of glaucoma, and in certain cases we use gonioscopy, and they are working on a genetic test. They have some genetic testing at the Animal Health Trust now with glaucoma. So with glaucoma, often what happens is the pressure can cause the eye to become enlarged. Once the eye is enlarged, the eye is blind. And the technical name for this is called buphthalmos. And the bup part of it means ox or cow eye. And buphthalmos means a cow eye. Now in humans what would happen with glaucoma is the eye would swell up and become the size of a cow eye. Fortunately in dogs we don't allow the glaucoma to get that bad, so they have really huge eyes. But that's where the name comes from. And dogs with glaucoma where the eye is enlarged can be uncomfortable, so they're just quieter. They're not as keen to go for a walk. And in some cases they're in obvious pain. And when the eye is blind and enlarged like this, either eye removal, or there's a technique that we can do where we put in like a false eye. That's really from a cosmetic point of view. But the most important thing about glaucoma is prevention. But also, if we have a purebred dog with glaucoma in one eye, both eyes have an abnormal drainage angle. So the take-home message is, if you ever hear about glaucoma, get the other eye checked, because it's likely the other eye will be abnormal. So if we go, oh yeah, it's got glaucoma, the eye is blind, we'll take the eye out, and you do nothing, there's a 50% chance the remaining eye will develop glaucoma within the next 9 months because that eye is predisposed. If we use drops, and the drop we normally use is called a Zaga, it's actually a human drop, so I just write a script for the human chemist. The risk of glaucoma reduces to 40%. So what that means is most dogs, 60% of dogs, don't get glaucoma, but at an average of 30 months. So it reduces the risk of glaucoma and delays it. But that's really important. If you ever hear of a diagnosis of glaucoma, make sure the other eye has been checked, and if it's at risk, actually start on these drops. Any questions? The next thing I wanted to talk about is lens luxation. And a lens luxation is where the lens is out of its normal position. Now, this can occur as a result of trauma, but also certain breeds of dogs, anything with terrier in its name, just assume that they're going to be predisposed to lens luxation. Most commonly, fox terriers, Jack Russell terriers. And the first thing that happens is the lens actually moves backwards. So this is a posterior lens luxation. You can actually see the edge of the lens as the lens is falling back into the back of the eye. Most dogs with a posterior lens luxation are asymptomatic. But in some cases, the lens can come forward into the anterior chamber, and we can actually see the lens sitting here. So can you see the edge of the lens? That white line? That's the edge of the lens. So the lens is actually popped forward into the front of the eye. And this can cause severe pain due to glaucoma. And urgent surgery is needed to go in and actually remove the lens. Again, because they get glaucoma, you've probably only got 24 to 72 hours to resolve the glaucoma. If you get it early, these dogs can actually do quite well with surgery. If it's been going on for more than 72 hours, the chance of getting any vision back is almost zero. Cataracts. Lots and lots and lots of dogs can get cataracts. Purebred dogs in particular predisposed to cataracts, and there's a long list of inherited diseases. So we can see here this Australian cattle dog, and we can see the cataracts. So a cataract is where the lens goes cloudy. It's not like a film or a coating. All of the inside of the lens goes cloudy. The inside of the lens is composed of lens protein. Another form of protein is egg white. So if you cook egg white, if you beat egg white, if you whip egg white, it goes cloudy. Anything that upsets the lens protein will make the lens go cloudy. So in humans, smoking, sunlight, old age are risk factors. In dogs, inherited factors. We see lots and lots of inherited genetic cataracts. So you can see here the lens has gone cloudy, so quite a well-developed cataract. Here is another cataract in a miniature schnauzer, and you can see that the eye's gone cloudy. A lot of cataracts occur by breed, and they occur at specific locations within the lens at specific ages as well. One of the other cataracts that we can sometimes see are so-called star cataracts. And can you see this tiny little triangular shaped cataract? That's on the back of the lens. And this is called a star cataract, and we see this commonly in a number of breeds. And we can also see here a cataract that's slightly larger. So this cataract's actually started to grow a little bit. These are star cataracts. We see these quite commonly in Labradors and Golden Retrievers and Rottweilers. They're sometimes called PPS cataracts, posterior polar subcapsular cataracts. What's really interesting is in dogs, probably 98% of the time these cataracts do not progress. What's really interesting, talking to human eye specialists, this type of cataract in a person is a big problem because people have trouble using their computer screens, and when people are driving at night time, the lights from the oncoming cars reflect off the cataract and dazzle people. But most dogs aren't using a computer, and hopefully your dogs aren't out driving at night time, so they cope quite well with star cataracts. But from a breeding point of view, it's certainly something we'd want to try and breed away from. Occasionally, we'll see these nuclear cataracts. So you can see this little opacity in the centre of the lens. And some breeds of dogs, probably Cavaliers would be number one, can have these nuclear cataracts. With cataracts, that's a thing that we do surgery, where we remove cataracts. We've got to take out 4 cataracts tomorrow at our clinic. So we actually do the same technique as that is used in humans, where we smash the cataract with ultrasound energy, suck out the cataract, and then we implant an intraocular lens. And it's like anything, if you get onto it early, we can actually have quite high success rates with cataracts. Any questions on cataracts? Many breeds are predisposed to cataracts. Okay, looking through to the back of the eye. So what we've done here is we've dilated the pupil and we've taken some pictures. So these are pictures of the back of the eye, what we call the fundus. And with dogs, we have the optic disc. This actually goes up to the brain. And sometimes when there's problems in the brain, you can actually see changes here in the nerve tissue, the optic nerve. You can see swelling sometimes. We have this reflective layer called the tapetum. And again, reflective layer, a little bit browner in this dog. The tapetum can actually vary depending a lot on the coat colour. We have the blood vessels. The big ones are the veins that come into the optic disc, and the smaller ones are the arteries that put blood out into the retina. So we're looking at the back of the eye. We're looking at the optic disc, we're looking at the tapetum, the reflective layer, and we're looking at the blood vessels. So dogs have a tapetum so they can see slightly better at night time compared to humans. So that's why dogs have this yellow, green, sometimes an orange reflection. So that's a normal fundus. Collie-eye anomaly is an inherited defect that we see obviously in collies, Shelties, Australian Shepherds, and there's a few other breeds as well. So here is the back of the eye, the optic disc. You can see the tapetum. In this dog it's more of a yellow colour. You can see the veins, you can see the arteries. But what we can see here is this red area. And this is what we call mild collie-eye anomaly, because there's abnormality of the choroid, the blood supply. And sometimes it's called choroidal hyperplasia, and sometimes it's called chorioretinal dysplasia. So basically, this is abnormal tissue at the back of the eye. And mild collie-eye, often you won't recognise that it's there. Dogs are completely normal. It's not progressive, there's no treatment needed. There is certainly very good genetic testing available. So within 2 or 3 generations with genetic testing, we should be able to get away from collie-eye anomaly very quickly. One of the reasons why we do want to get away from collie-eye is sometimes we get severe forms of collie-eye anomaly. And this is where we get these collobomas, and collobomas are like holes in the back of the eye, in the optic nerve. So you can see a big colloboma here, and in this dog here, a huge colloboma in here as well. The reason that we worry about this is these dogs are more prone to detaching their retinas. So they actually detach their retina, they go blind. Then it gets worse. Because the retina's detached, they can often bleed into the eye, so these collies will present with an eye full of blood. And when the eye fills up with blood, they often get glaucoma. And as we know, glaucoma then ends up causing pain. So collie eye anomaly can be quite a significant problem. Now, the other one is a condition called retinal dysplasia. Dysplasia means abnormal development, and that can happen for a number of reasons. We see a thing called retinal folds, and retinal folds is considered to be the most mild form. Often it's an incidental finding. So we will sometimes see these little white lines in the retina, in the non-tapetal fundus, and an ophthalmologist from Switzerland, Bernard Spiess, was kind enough to allow me to use his slide. So we have these little white lines. In this one here, we can see these lines in the tapetal fundus. Sometimes in puppies, you will see these little white lines, and it's considered just to be a developmental thing. It's where the eye, the two layers of the eye are growing at different rates. You've got the white of the eye, the sclera, and sometimes the retina grows too quickly and the retina just folds up on itself. And each of these white lines represents a little fold in the retina. Sometimes retinal folds, they're there at 8 weeks of age, and as the pup grows, it all goes away. To me, they're not inherited. But we can also get this condition called multifocal retinal dysplasia. And certainly this slide here, you would classify as multifocal retinal dysplasia because it's quite diffuse. This one here I just call retinal folds and they'll probably grow out of it. MRD is quite a big problem in a number of breeds. Cavaliers, Golden Retrievers, Labradors. And in severe forms, it can lead to retinal detachment. The good news here in Australia, we rarely get the severe forms. So, here are a couple of pictures of MRD. So we can see this like crescent-shaped fold, this huge fold in the retina. What's really interesting is when I showed these slides when we had a meeting of the Australian College, we had a couple of UK ophthalmologists out, and they said almost without exception in England, if they saw a lesion like that, they'd expect the retina to detach. And that's pretty rare here in Australia. Why? I don't know. Here is a Labrador that's got quite a large fold in the retina. And here's, I think it was a German short hair pointer. Can you see all these little dots in the non-tapetal fundus? And that was another form of MRD, multifocal retinal dysplasia. PRA. Remember, George gave me a list of the dogs, of the genetic tests, and he also gave me a list of the genetic tests for PRA, and I couldn't fit it into the page because it was 300 breeds. PRA, an autosomal recessive trait. Many breeds. The number one breed at the moment are Labradors, probably closely followed by cattle dogs. The first sign of PRA, the first clinical sign of PRA is poor night vision. And when I lecture to veterinary students and to vets, I always say if anybody says, oh, my dog's got poor night vision, I just make a diagnosis of PRA, particularly if it's in a purebred dog. So this is our normal fundus, and here is, say, a 5 to 8 year old Labrador. that's got poor night vision. We can see here the optic disc, that looks good. You can see the veins, the larger blood vessels. Guess what's missing? See all these smaller ones, the arteries? We can't see those as well. And basically, that's one of the first signs when we look at the back of the eye is the arteries go. Now, what happens later on, as the disease progresses, the back of the eye gets more shiny. So what I've done here is I've just left the flash artifact on normal, and basically it flashes back so you can't see anything at the back of the eye. So I had a dog this afternoon, and just using the focal light, the little light to test the eyes, I could see these eyes glowing back at me. So I made a diagnosis almost on that. So in this picture, I've turned the flash intensity down, and this is the tapetum, the reflective layer, and it looks very granular. You can just see the veins, so the blood vessels are thinner and thinner. I can't really see the arteries at all. So that's what happens with PRA, progressive retinal atrophy. So with progressive retinal atrophy, poor night vision. And that's because with PRA, the first sign is poor night vision because the rods, which are the cells with which we see at night time, they degenerate first. Later on, as it gets worse, the cones degenerate and then we lose vision. So classically, PRA, at 5 years of age we have poor night vision. Some 18 to 36 months later they start to lose their day vision, and then cataracts start to form. And the very characteristic cataracts that we see are these little bubbles in the lens. You can see here how there seems to be more reflection coming from the back of the eye, and that's one of the signs of PRA. And we've got these little bubbles here, that's the vacuolar cataracts. And we can see here these little bubbles forming in the lens because of the PRA. And later on, they'll actually develop full-blown cataracts. So this Labrador has had night vision problems for about 2 to 3 years, and now it's developed quite solid cataracts. So cataracts will often develop secondary to PRA, and in these cases there's probably no benefit in removing the cataract because the dog's going blind because of the retinal problems. However, there was a really neat study done in England, and they actually showed that Cocker Spaniels will benefit with improved vision for probably 2 to 3 years after having their cataracts removed, even if they have PRA. But for most other breeds, there seems to be minimal benefit. One of the comments that I would make about PRA is supplementation. There's a product on the market called Oculoglow, and it's certainly something that we have in our practice, and it's been recommended to actually slow down the rate of retinal degeneration and cataract formation in cases of PRA. The problem is they actually haven't done any controlled studies to show that it's beneficial. They have showed that it's beneficial for diabetics, but generally speaking probably not beneficial for PRA. Well, we don't know. If you have an owner that's keen on antioxidants and they want to do everything they can, probably a good idea. In humans we have macular degeneration, and interestingly in humans they've done lots of studies and they haven't showed any particular benefit in using antioxidants. However, for dogs with diabetes, the Oculoglow has been shown to actually slow down the rate of cataract development. So if you have a puppy, or sorry, it won't be a puppy, but if you have a dog diagnosed with diabetes, it's certainly worthwhile then putting them on the Occuglow. Now, cataracts are not benign. So let's say you've got an old dog or a dog with PRA, surgery is not an option. What can happen is the body recognises that there's a cataract there, and they recognise that the cataract shouldn't be there, and the body actually mounts inflammatory response. And what happens there is the eye becomes red. We can see a thick cataract here, and what will then often happen is that the cataract will cause inflammation, and in this eye the cataract has actually moved and the pressure inside the eye becomes uncomfortable. So if you have a dog with a cataract and surgery is not an option for any reason, it's very, very, very important to have them on anti-inflammatories to stop pain and discomfort from developing inside the eyes. Any questions?
Does dry eye caused by an autoimmune response?
Is dry eye caused by an autoimmune response? The answer is we believe so. So dry eye is a lack of tears, and a lack of tears will often present as the thick discharge, recurring ulcers, recurrent conjunctivitis. What's really interesting, we're talking about immune responses. The drugs that we use to treat dry eye, Optimmune, and also tacrolimus are drugs used in human to prevent tissue rejection. And that's an immune response. So it's really interesting that dry eye, the drugs that we use probably modify the immune response, but also in themselves the drugs actually stimulate the tear glands. Yes?
With the droopy eyes or the droopy eyelids, in with the slides that you had up there, most of the droopy eyes were top and bottom. So with the bottom being droopy, the top came over. Is that always the case?
No, there's lots of variations. It really depends on the breed, the age, and what's the underlying problem. So there can...
It's not all droopy eyes are
No.
a problem?
No. Some are. But again, as I was saying before, the take-home message would be that we'd have dogs with nice tight eyelids that sit comfortably around the eyes, because the eyelids are very important in blinking and pushing tears across the eye. And of course, we don't want eyelids rolling down onto the eyes.
So when they're droopy down the bottom?
Droopy down the bottom means that they don't blink properly, and that makes them more prone to getting dry eye and what we call exposure, where the eyes can actually dry out.
So I can ask my own question, more because I get so many inquiries through the general Facebook groups. Just to clarify on the PRA and the cataracts. So PRA will be something that is there initially.
Yes.
And the cataracts that start to develop from that, if you see them early, will in fact be slightly different to a, let's call it traditional cataract?
Yeah, let me, I need my own glasses now. Let me drag this down, because the cataracts are quite different. So here, whoop. So here's a dog with a solid cataract. And that's not uncommon for that to develop. But with PRA, what actually happens is as the retina degenerates, it releases toxins in the back of the eye, and they float through the jelly of the eye and they come onto the back of the lens. So these form little bubbles on the back of the lens, and these are called vacuola, like little vacuoles or bubbles. And they, as soon as I see that, I think of two things: PRA or diabetes. The PRA, classically, in the classic form of PRA, they go night blind at 5 years of age. Probably 2 years later, they'll start to get these little cataracts. 3 years later, at 8 years of age, they're blind. And by 8.5, they'll end up like this, with these mature cataracts. And you can see the pupils are dilated because the retina, the nerve tissue at the back of the eye, has undergone degeneration.
So that's the PRA sequence.
Yep.
If dogs are prone to cataracts, and I've certainly had no experience, thankfully, what's the age onset for a traditional cataract?
Well, it depends on the breed. We have seen miniature schnauzers, cavaliers, bichons blind at 6 months of age with cataracts. Yep. Yeah, I got a Boston Terrier. Did you see that today? Amy's a vet visiting from the Royal Veterinary College. We had a Boston Terrier 2 years of age and is now almost blind because of cataracts. So, yeah, it depends on the breed. And as I said, these young dogs, we will see cataracts develop at an early age, 6 months of age. Other dogs, it can be 3 years of age, and other breeds of dogs, it can be 8 years of age. Generally speaking, as a breeder, if you get a dog to 8 years of age and it has normalised, it's unlikely then to go on to develop any inherited problems. Yeah. Yes?
Good. Ah.
Oh, there's no
Sorry.
voice.
Sorry. Oh, yes, there's no voice. Would you like to just pass it back?
I don't know if they're allowed to. And you just need to hold on to the bottom section. Okay.
If you have cataracts at, say, that develop at the age of 10 or above, would you determine that they were hereditary, or they are just something that comes with a dog at an older age?
So the question there is, if I saw an older dog, say 10 years of age with cataracts, would I consider that to be inherited? Generally speaking, most of the inherited cataracts would come on at an earlier age. So if you've got a dog over the age of 8 and then it develops a problem, unlikely to be inherited. The reason is that basically Mother Nature's very clever most of the time, and what she does to try and stop inbreeding is for these developmental problems to present earlier rather than later. Because if they present at 10 years of age, that dog might have been inbred, had a genetic fault, but it's then bred. So that's why you'll see orthopaedic problems at a young age. That's why, as I was saying before, you'll sometimes see bichons and miniature schnauzers and cavaliers with cataracts at 6 months of age blind. So if we extrapolated that to the real world and dogs were having to hunt, if they were blind at 6 months of age, they die pretty quickly. They're not going to spread those genes. Yes?
What about shampoo when washing the dogs? Different shampoos cause diabetes as well.
Robin, can you just repeat that?
I'll repeat that question. What about shampoos and other things when you're grooming? Absolutely. Unfortunately, we see lots of dogs that can get chemical burns and irritants to all sorts of things. For example, there was a product a few years ago used to remove stains from the tear film, from the face. and that was quite caustic, and we had a few dogs that got burnt by that. So I'm slightly paranoid when I'm bathing a dog or shampooing a dog. I like people to put bland ointments into the eye. So you can buy ointments just over the counter at a human pharmacy, Visco Tears Gel or Gentil Tears, and actually coat the eyes with ointment before you shampoo around the head, or you're going to try and get rid of the tear staining. Absolutely. They can be really quite irritant, and I've seen some nasty shampoo injuries to the cornea. It strips the whole of the skin layer off. It can cause quite a lot of scarring, but more importantly, a lot of pain. And they need to be treated very effectively. Do you know what's a very effective treatment for ocular pain where you damaged all of the cornea? Cocaine. Cocaine eye drops are very, very potent. So you just need to go, yeah, if you get arrested, just say, I'm out to get eye drops. But it's very interesting, cocaine is actually a very good anaesthetic agent. So I'm not recommending illegal drugs.
We've got a couple of questions here from our live streaming audience.
Hello, live streamers. Sorry you can't be here, we've had a fantastic time. It's better in real life.
I could cheat and just use the initials because my pronunciation probably won't be right. Clive asks, has corneal endothelial degeneration been spoken about?
No, I haven't talked about corneal endothelial degeneration. There are certain breeds where the cornea degenerates. The endothelium are cells on the inside of the cornea that suck fluid out of the cornea, and in certain breeds of dogs, particularly Bostons, Chihuahuas, Springer Spaniels, they can have an inherited problem. And what happens there is probably around 5 to 6 to 8 years of age, the endothelial cells, which normally keep the cornea dehydrated, die, and then the fluid isn't being sucked out of the cornea, so the cornea starts to go cloudy. And in those cases you get opacity in the cornea, and in some cases you can get blisters, little bubbles forming in the cornea, and they can be quite painful. So initially we start with drops called hypertonic saline to try and help suck the cornea out of the water. To suck the water out of the cornea. And then in some cases we do surgery. If you or I had corneal edema, they'd give us a corneal transplant. They don't tend to work so well in dogs. So what we tend to do in most cases is treat them with the hypertonic saline salt. If that's not working and or the dogs get ulcers, we sometimes do surgery where we put a graft into the cornea to suck the fluid out, or sometimes we use a thing called thermal keratoplasty where we make small little burns into the cornea to try and scar up the eye to make it more comfortable. But certain breeds are predisposed to corneal endothelial degeneration. There's no genetic testing for that at the moment.
And Clive also asks whether dogs get macular degeneration.
No, because dogs don't have a macula. A macula is an area where there's a lot more photoreceptors, and the photoreceptors are what we actually see with. Dogs and cats will have a thing called a visual streak where they'll have slightly more photoreceptors in one area compared to another. So sighthounds like greyhounds, they have quite a prominent what's called visual streak where they have a rich area of photoreceptors. And dogs that are lap dogs, they don't have a visual streak, because if you're a lap dog, you just sit on a lap. You don't need to have really good sighthound type vision.
And what about the brachycephalic breeds with that different?
Yeah, brachycephalic breeds, so the dogs with the short nose, prominent eyes. We see lots of corneal disease because they've got the large prominent eyes. And particularly the pugs, the peaks, the shih tzus, they also have the nasal fold, so the inside corner of the lower eyelid is rolled in and then scar tissue grows across the eye. So in those cases we often use a drop called tacrolimus to actually try and help reduce that scarring. If you look at the breed standards of pugs 200 years ago, they had quite a long nose. If you look at pugs today, short nose, prominent eye with the nasal fold in there. And that can cause quite a lot of scarring.
And Sylvia asks if you're still seeing cases of PRA in Labradors.
Oh, absolutely. Unfortunately, Labradors are still the number one breed. I would say we would see a new dog come in once every 2 weeks with PRA, and there's certain areas of Victoria where it's more common. We do a clinic in Moe in Gippsland. Every clinic down there I make a new diagnosis of PRA.
But there is a genetic test for PRA?
Yes, very much so. Yeah, very much so. My impression is that the Labrador Club, when the genetic testing first came out, they were very, very proactive, and I think the people who are members of the Labrador Club, they don't have a problem, but unfortunately there's too many backyard breeders out there who don't know, and they're not doing the genetic testing. So my impression is that the registered breeders, the breeders that are active within the club, don't have a problem. And that's why I guess you guys are very good at educating the public out there. People need to buy dogs from, breeders that are doing the right thing. Yeah, it's just such a shame. Yes?
Are lipid deposits a problem?
Lipid deposits a problem. So there's a number of causes of lipid. Lipid is fat, and would you believe cholesterol? So a number of breeds of dogs are prone to corneal lipid dystrophy. Cavaliers, collies, there's a few others there. Cavaliers, collies, Samoyeds, yeah, not to a huge extent, but yes, there's a few there. Golden retrievers, there's a few from time to time. Most of the time, with the inherited corneal lipid dystrophy, it's not a big problem. It's more of a blemish. But what can happen in older dogs, they can get lipid secondary to old age and scarring. And as dogs get really old, that lipid calcifies. Everything as you get older, your spine, your joints calcify. And in those cases, what can happen is that the dogs then get really sore ulcers in the cornea because the lipid, the calcium, it's almost like sandpaper. So in those dogs, when they're really sore and uncomfortable, we put local anaesthetic in, the dog's instantly more comfortable, and then we have a little diamond tip burr, and we actually sandpaper or burr off that unhealthy tissue, and the dogs are instantly more comfortable. Yes? Hang on, Margaret's coming with the...
I'm limping towards you.
I have a rehomed Samoyed, and she's 8 years old, and she has, beside the normal dark brown area, an extended area of that brown pigmentation on the side. What would you say that is from?
Pigment can develop for a number of reasons. Sometimes pigment just develops for no rhyme or reason. So think of it like a mole or a freckle. In some cases, pigment can come because of irritation. So sometimes in Samoyeds we'll see extra eyelashes. Sometimes we'll see dry eye. But generally, if there's irritation, there's more discharge, more irritation, so the eye's a bit sore or blinky or squinty. In rare cases, it can be a growth, but it sounds like there's no other clinical symptoms there.
The only thing I've noticed is that there's a bit of black dirt that appears in the corner, like a dry lump of dirt.
We often see that in many
Is that
breeds.
normal?
Yeah, it's often normal.
Okay.
With your genetic testing, with the eyes, like I know your genetics don't change, but does it matter what age you test them, whether it's 6 months or 6 years?
No, because hopefully your DNA is never going to change. Yep.
So
No.
that's the same with your diseases and that?
Yep. Because our DNA that's us. Yeah, That's us.
Any other questions?
So far as I know, there's not a genetic test for star cataracts in Samoyeds.
No, they have been doing a little bit of work at the Animal Health Trust in England on star cataract DNA testing. I'm not sure how far that's got.
If you have a dog which isn't affected, but has produced
Star cataracts. Yep.
Would you continue using it? Or
there are a number of causes for star cataracts. I think the main one is inherited. Sometimes it can happen because there's some sort of insult or defect during embryonic development. We had recently had a litter of purebred dogs and the bitch had mastitis and the puppies had to be bottle fed, and for some reason or another the milk replacer wasn't complete and all the dogs developed cataracts. 10 out of the 10 pups in the litter developed cataracts because the milk replacer wasn't quite right. With star cataracts, it's not a big problem in the Samoyed breed, and occasionally they'll just develop for no rhyme or reason. But in some breeds of dogs, particularly golden retrievers, Rottweilers, Labradors, I think it's mostly inherited. The good news with star cataracts is that 98% of the time we don't have problems. They don't progress. Poor night vision when they're driving and when they're using the computer screen.
Someone here has a question about older dogs coming into your clinic. Is it recorded as to whether they are pedigree or not, and does this information get recorded for analysis?
We basically, when we're doing ACES certificates, they've obviously got to be registered breeding dogs. So for that we record that, but for general things we don't.
I suppose I could expand that question and flip it on its head a little and say the obvious. Pedigree dogs, crossbred dogs, which ones are likely to present more with issues?
If you come and spend some time in our clinic, you will see a predominance of purebred dogs.
But whether that's the sampling or not?
Well, they come to us because they've got eye problems, and most of the eye diseases we see are inherited, and that's why when I lecture to veterinary students and veterinarians, I talk a lot about breed predisposition. But one of the other things you've just reminded me of is some of these other breeds that we see, like Labradoodles, Groodles. Guess what? They get the problems as well. Yeah, cataracts, PRA. So we're starting to see quite a lot of PRA and cataracts in Labradoodles at the moment.
Yeah, a lot of the pet people take dogs in to be checked though.
Sorry?
A lot of pet people don't take dogs in to be checked.
No, a lot of pet people don't.
And that was my question about whether what you were seeing was what sort of cross-section of the dog population you might have been seeing. I
guess what I tend to see is dogs that have problems. Yeah.
Yep. And a couple more have come in. Can you explain geographical retinal dysplasia?
Dysplasia.
Yes.
Geographic retinal dysplasia. Remember before we talked about MRD, multifocal retinal dysplasia, where there are little lines? With geographic, they tend to be the bigger ones, and I guess geographic means large. So sometimes with geographic retinal dysplasia, again, Labradors, Golden Retrievers, Cavaliers, they're quite large lesions in the back of the eye, maybe occupying 25 to 30% of the back of the eye. Again, we'll see those in young dogs, very much so.
And another one here, what is the cause of
Anisocoria?
That's it, thank you.
Anisocoria. There's lots of causes for anisocoria. Anisocoria means different sized pupils. So you might have a large pupil, you might have a small pupil. From a breeding point of view, one of the things that can happen is iris atrophy. The iris can be thinner, and if the iris is thinner, it can't constrict. So we see that most commonly in miniature poodles and toy poodles. They have a thin iris, so the pupil is more dilated. So clinically, these are middle-aged to older dogs, and they'll go outside and they'll squint in the bright sunlight because their pupils can't close down. And it'd be a bit like us if we suddenly went outside now and it's dark and then suddenly there was a bright light. We'd squint for a couple of seconds until our pupils closed down. But in these dogs, they can't close their pupils down, so they walk around in bright sunlight with their eyes closed.
And one more, I'll read this out exactly as it's worded here. If a breeder breeds from dogs free of a disease such as entropion, is there a greater likelihood that the pups will be free of that disease?
Generally speaking, with entropion, as we said before, it's not considered to be an inherited disease under the ACEs, the Australian Canine Eye Scheme. So generally speaking, if you have a dog that has nice, tight eyelids that sit nicely around the eye, then you are less likely to breed problems like entropion. If you have dogs that have large, loose eyelids, then you are more likely to get entropion. But then, in some cases, the dogs can be predisposed to entropion, but the eyes are never irritated, so they don't have a problem. Then you might have a dog that has large eyelid openings and lives somewhere where there's a lot of dust, dirt, irritation, pollens. That irritates the eye, and then that can cause a secondary entropion. As I was saying before, one of the really, really important things is that we need to have breed standards where the eyes sit nicely around the eyeballs. We don't want to have breed standards for dogs with droopy eyes or large eyelids or, big diamond eyes, because that's very, very unhealthy. It's quite exciting doing a live stream, isn't it?
Yes, I'm really
I feel like I'm swimming upstream at the moment.
It would be easier if you were reading the things for yourself.
I thought your pronunciations were very good, Margaret.
Thank you. I thought maybe it might have been a good role for our visitor. No more questions.
Terrific. Thank you very much.
Well,
yes.
Yes.
Have you come across the retrobulbar abscess in Australian Shepherds?
I'm not sure there's a specific syndrome that I'm aware of retrobulbar abscesses in Australian Shepherds. A retrobulbar abscess is an infection behind the eye, and that can come about for a number of reasons. Sometimes it can be a tooth root, a rotten tooth root drains up in behind the eye. Young dogs that are very active running around chewing on sticks, a bit of stick can go up and behind the eye. Sometimes older dogs that are unwell, we can end up with infections behind the eye.
And if they've actually had one with the tooth removed, but his eye had swollen with the pressure.
Yep.
And then now it's been 3 months. I've noticed that the muscle wastage in the head was there, but now it is starting to come back. Would the eye, it's like the eye is sunken in a fraction, is that a chance to come back to normal?
Probably not. Generally when they lose condition around the eye, they lose some of the fat pad and the muscle, so the eye sits back.
Okay.
Yeah.
And is that, so that wouldn't affect with breeding?
No,
wise?
to me,
it's just
that's just one
luck?
of those unlucky things. Yeah.
That's what I've been told, but now it's
no, that's just one of those unlucky things. It's not an inherited genetic thing. Definitely not. And I love Australian Shepherds. I'm very biased. We're on my second one now.
And I have to say that I'm so impressed with your Australian Shepherd that I actually named one of my dogs Blue.
Oh, did you? Oh, that's great. So our Australian Shepherd wanders around the clinic, and if you have any food whatsoever on your person, he is out there front and centre. He's a very good food detector dog.
I've got one sort of fairly general question that we might make our last here. a few thanking you for your presentation.
Oh, thank you.
But which way? So with that in mind, and I think we were talking about sort of generally, should all breeders be checking their breeding dogs for these conditions before breeding?
So a lot of breeds don't seem to have many problems, but if you're dealing with a breed that is known for having problems, and I guess you would just ask around and you'd get a bit of an idea or speak to your local eye specialist, then if there's a problem, then it'd be worthwhile doing. And we certainly, as Carol with the Golden Retrievers knows, we do eye certification nights, and people can come along then and get their dogs checked. The other thing to do is to look in the Blue Book, particularly the American College Book, because that's very useful and actually give incidences of eye diseases. And the other thing I would strongly recommend is if you're going to the expense of importing a dog or semen from overseas, please, please, please get an eye certificate before the dog comes over. I, on a number of occasions, have had to go out to quarantine because people have bought a dog, come in, and it's got all these horrible eye problems. So please, 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 if you're going to import a dog or semen, make sure there's an eye certificate there before you go to all that expense. And as we know, it is very expensive to import dogs.
And another question about the one I've forgotten to pronounce properly,
Anisocoria.
Anisocoria. A breeder has a 7-week-old puppy diagnosed with it. Is it genetic?
It depends on the cause. I saw a 7-week-old miniature poodle tonight that is blind. Its pupils were dilated and non-responsive because he doesn't have any optic nerves in the back of the eye. So it depends on the cause. Anisocoria means different sized pupils. That can come for any number of reasons. Could possibly be inherited. My gut initial response would say probably not.
And one last question, perhaps we'll make it. Someone's been told that only one parent needs to have an annual eye test. Is that true in Labradors?
No. With Labradors, I guess as we were saying before, what we'd be wanting to do is to reduce the incidence of PRA and cataracts. And PRA is an autosomal recessive trait. So a recessive trait means it comes from both parents. Now, if you did DNA testing on one dog and that dog was genetically clear, then the bitch, doesn't matter what she's got because all the puppies are going to be normal, they're not going to be affected. But again, from a breeding point of view, we need to both do the genetic testing but also to do the eye examinations as well.
Good, okay.
Thank you very much.
Thank you. Thank you.